Hello, my name's Sian, and I've had breast cancer, and this is my story. Came for the mandatory mammogram, which you always should do, and then I got a letter some weeks later saying, could you come back? I assumed that it's because the photograph wasn't right, in layman's terms, and I very nearly didn't come because my daughter was staying, but she said no, go. I'm glad she told me to come. I sat down with two nurses. One nurse was on the screen chatting away to me because I didn't want to look. She was lovely. And I was talking about how much I hate pain and it wasn't painful. And they took a biopsy of my breast and of my lymph nodes. All a little bit nerve-wracking because all of these words are a bit triggering, aren't they, to anybody? But everyone was just so calm and it seemed so normal and natural. And they said I would be hearing very soon what the results were, which I did very, very quickly. So we sat there and he was great, talked me through it, talked to me what we should be doing. I was going to be having a mastectomy. This was the way, this is what he suggested. And I was going, yes, let's just do everything that you suggest. We talked about reconstruction at that stage, and to be honest, at that stage, I just wanted to, no, let's just get this cancer out of me, was how I felt. So the appointment for the surgery was very soon, the 22nd of May. So things were moving very, very quickly. I know that people talk about these huge waiting lists, but that wasn't my experience. It was all very fast, very straightforward. I had another couple of appointments in between that appointment and my surgery. Although my initial thought was just, oh, I'm going to die. I'm sure everyone thinks that. My sister and my father have both died of cancer, and my brother has had skin cancer, so it's kind of very aware and thought automatically the worst outcome. But then I think the thing that is almost a lifesaver for me was the fact that I had to be positive and I had to be strong for my kids. My son had come down from Glasgow to be with me, which was wonderful. And he and my neighbour drove me here to Musgrove to the day centre surgery. Oh God, everyone was so wonderful. And I was very lucky because I was the first person to go for my operation. Came round on the ward, and there were lots of women chatting. And I was being very lazy, thinking, oh no, I'm not going to open my eyes, I'm going to wait and have some more morphine, or whatever it is they gave me. And people kept coming and saying, are you all right? Would you like a cup of tea? Would you like some toast? Mm-hmm. I remember it being very sort of relaxed. So I had my toast and my tea, and my son arrived and brought me home all in one day. Quite extraordinary. I had a drip from the surgeries, from the wound, I suppose you'd call it, with a very pretty little handbag for it that was given to me. It was honestly, and then I think I was a bit away with the fairies because I talked, strangely enough, for hours to my son as he tried to feed me. I was chat. But no, it was fine, and the truth is there was no pain. I honestly am terrified of pain. But there was no pain, and I just did as I was told, absolutely what I was told. The next stage of the journey was to book me into the Beacon Centre for radiotherapy every day for 3 weeks. Again, it was just, I sound like an advert. It was a really, really good experience. The radiographers or radiotherapists that you see on a daily basis were just wonderful. You tended to see the same people every day waiting in the waiting room. I saw the Red Cross vehicles bringing people in who couldn't drive. There are times when that happens, when even the most positive and sort of enthusiastic person can sort of feel low, and there is a kind of low-level anxiety, I guess you could call it, I think, that must run through any survivor of cancer, which is it going to come back? And again, I would say just do as you're advised, do as you're told, and keep an eye open. Just keep checking, just watch yourself. I perhaps have done what I've always done, which is be very, very positive and think about what other people are thinking about. So protecting people around me from this diagnosis, as opposed to thinking about it myself, which might be something I still have to deal with, I don't know. So I think that would be something, but I'd have to change my personality really to do that. But I think to take time for yourself would be, think about it, but don't dwell in it, because the outcomes are increasingly positive, particularly if this damn disease is caught early. So trust the process. Do as you're told. She says with her tongue in cheek, having the first time in my life, in my 60s, I'm doing as I'm told. But it does work, the exercise and being active. And I guess that this sort of life-changing thing that happens to you when you're diagnosed with cancer, and it is life-changing, does kind of maybe reset your mind a little bit, to taking time to do the things that you love, maybe discover new things that you love, taking time to be with the people you love. And just celebrating the fact, celebrate every day, because here we are.
So my role in the Trust is to lead the breast care nursing team. So we're a group of clinical nurse specialists, and we cover all aspects of the breast cancer journey. So that's from screening to symptomatic to secondary breast cancer. The purpose of the breast screening programme is to invite people from the ages of 50 to 70 to attend for their 3 yearly mammograms. And the process is it depends on what gender you are registered as at your GP surgery. So if you're registered as a woman at your GP surgery, you will get recalled every 3 years. If you have changed your gender, then you do need to self-refer at present into the breast screening programme, but this is only for patients that are aged 50 to 70. So we tend to recall dependent on location. So we have the vans that go into, let's say, Morrison's or Asda car parks, and they're timed slots. So you go in and you see the radiographers and they do the mammogram, and then you will get the results in the post. And occasionally you do then get recalled back to Musgrove Park Hospital to have some further tests. I love patients. I love my job. I'm incredibly passionate about breast cancer. So prior to me doing this role, I worked in theatres, and I was a scrub nurse working, doing breast cancer surgery. And I thought, actually, this is for me. I love helping people. A massive part of being a clinical nurse specialist actually is a supportive role. So we support patients throughout the hardest parts of their lives. A cancer diagnosis, it completely, as Sian said, it completely changes your life, and to be there, to be that person that supports somebody through that it's just so incredibly rewarding. It is an incredible privilege to support anybody going through a breast cancer diagnosis, and you're not only just supporting them, you're also supporting their families as well. I think anybody going through a breast cancer diagnosis, I think the importance is for them to reach out to your community, to your family, to your friends, to us, to the clinical nurse specialists. Unfortunately, sometimes you do get our voicemail service because we are there in clinic supporting other patients. But I think if you're thinking something, and we get it all the time, I didn't want to bother you, but you're not bothering us. This is why we're here. We are here to support you. And I just really want to reiterate the importance of that. October is Breast Cancer Awareness Month, and I think it's fantastic that we do all of these charitable fundraising events to make people aware of breast cancer, but actually we need to be aware of it the other 11 months of the year. I think you need to look at what's normal for you, okay, and check, as breast cancer now say, look, touch, check. Okay, you need to see what is normal for you once a month. So what I do personally is I have an alarm on my phone, and it goes off the same date of every month, because as women we have cycles that we go through, and your breasts change throughout the month depending on where you are in your cycle. My alarm goes off and I think, oh gosh, I need to check my breasts. And breasts for me is every day of my life because this is my job. But sometimes I don't think to check myself. So that alarm triggers me to know what's normal for me during that time of the month. And I think that is so incredibly important. And we all nowadays have smartphones and iPhones, and it doesn't take long at all. So I think that's really important. The purpose of the breast screening program isn't to find lumps. That's for us to do for ourselves. The purpose of the breast screening program is actually to find things or early changes in the breasts that you can't feel or see yourself. And so we want to catch it early. So attending for your breast screening is so important because we can detect things that you wouldn't be able to see or feel. And we want to catch things early to have a curative intent. And so it's so important to think, actually, no, I can't see or feel anything, but I'm going to attend my mammogram because actually there might be something incredibly small and tiny there that is very well treatable and that we can look after you and deal with. I think everybody's breast cancer journey is different. We can't go by your friend or your neighbour that's had a breast cancer. This is an individualised care, person-centred care, really. I think it's really important to take that away, that just because somebody's had a certain type of operation and treatment doesn't mean that that's going to be the same for somebody else.